The whole spine X-ray shows obliteration of the lumbar lordosis. Mammillary process is a small prominence of bone at the base of the transverse process which can be used as a starting point for transpedicular drilling. Using an awl, an entry point to the pedicle is prepared. The pedicle tract is then prepared with a 3.5 mm drill or a pedicle finder. The integrity of the walls is checked with the ball tip probe. The length of the screw is measured with the depth gauge and an appropriately sized screw is then inserted. It is preferable to check the screw positions fluoroscopically. Screws are inserted using the same technique at the other levels, in this case 3 levels above and below the osteotomy site. The coronal angulation of the pedicles varies from level to level, and this should be remembered while preparing the screw tracks. In this patient, the lumbar spine is in kyphosis and thus adjustments to the sagittal angulation should be made. The fluoroscopic images show acceptable screw position. The osteotomy is performed. Contoured rods are then connected to the screws. The screws, however, are tightened on the caudal side to allow closure of the osteotomy when the table is flattened. The flex table is gently flattened to close the osteotomy posteriorly. At this stage, a close watch should be kept on the osteotomy side to look for any thecal sac kinking by the leading muscle. Ultimately, 30 degrees of correction has been achieved. The posterior vertebral height is decreased while the anterior height is maintained. The anterior spinal column is stable. Good healing can be anticipated due to opposition of cancellous vertebral body surfaces. Bone grafting is performed with locally harvested bone grafts. The superficial correction has been achieved in this patient.